President Trump has done more for seniors in his first 100 days than any other group. I'm going to bring you the 7 big changes that the president has approved for seniors that's going to help with your Social Security benefits. And there is breaking news out of the Social Security Administration. There is a big change that they have made that's going to affect all 370 million Americans and how you interact with the Social Security Agency. I don't think seniors are going to like this change. I'm going to bring you the details. And then let's talk about food stamps. President Trump had this idea of turning food stamps into a box, a government box that is shipped to you with shelf stable foods that the government will pick every single month and send to you. That idea did not make it during his first term. Now that idea is being rebranded into a Maha food box. I'm going to bring you the details about that. And then if you're on food stamps, please pay attention. There's a lot happening with food stamps. Congress is about to cut 9 million people out of the program, including seniors, families, and veterans. I have all the details I want to bring to you. My name is Kwame Kwade. I am a personal finance expert and an entrepreneur. For 15 years, I have been helping seniors get the benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we've added video content. And I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. I really do appreciate your support. And as always, I want to know where you're watching this live broadcast from. Do me a favor, go into the comment section, let me know your city and your state. So let's dive in. So Trump's first 100 days, there's been a lot of action that has happened, and I want to bring you up to date on that. But let's talk about the Social Security change that just happened first, because this is a big deal and I don't think a lot of seniors are going to like it. Social Security is going to roll out a digital version of your Social Security card. This has hit the news. This is breaking news, and the change is being rolled out to all 370 million Americans. And the implication is that your Social Security card, the physical card that you have, is now going to be made available to you online. And this is the press release that came out of the Social Security Administration. The Social Security Administration is taking steps to provide significant enhancement to my Social Security account holders by introducing a secure, and that is their own term, digital access to your Social Security number. This innovative feature is designed to provide the American public with a modernized, secure, and accessible alternative to the traditional physical Social Security card. There's a lot of problems with this. Let's talk about it. The Social Security Administration is launching a secure digital version of your Social Security card, making it easier for everyone to access their information online. With this change, you no longer need to worry about misplacing your physical Social Security card, as the number will be accessible anytime through your Social Security account online. This digital feature is built to keep your personal information safe and reduce risk of your card being lost or stolen. Every My Social Security recipient, including seniors and those on disability, will be impacted by this shift to digital access starting early this summer. Why is this important? Well, the new feature will allow you to securely view your Social Security number online through the My Social Security portal, which is available through your computer and on your mobile phone. So if you lose your Social Security card, you don't have to wait any longer. You can just log in online and view it. But the problem is that if you can view it online, thieves and fraudsters can also hack and view it. So let's talk about why this is not a good idea. The Social Security Administration aims to provide faster, more efficient service by reducing the need for in-person visits when you lose your Social Security card. By moving to digital access, the Social Security Administration is committed to safeguarding your personal identifiable information. This is what they are saying in their press release. But feedback from beneficiaries highlighted the inconvenience of lost cards, and so they're trying to fix that. They say that they heard you and that this is what the public wanted, and now they're providing what the public asked for. But seniors and those on disability will no longer need to visit the Social Security office if you lose your card or you forgot your number. Digital access lowers the chance of your SSN being lost or stolen. This is what they are saying. But what are the experts saying? Well, Experts are saying that this is not a good idea because it's going to put social security numbers at a vulnerable state for hackers. Because think about it, there's been record number of hacks that have happened in the last year alone, where 125 billion data sets were hacked recently. So by the Social Security Administration putting all our information online, including our social security number, think about what it's going to take for a hacker to hack you. They need your social security number, your home address, which they can find easily online. They need your birth date, which some of them, if they try hard, they can find online. The last barrier was your social security number, which if you were secure with it with your card, it was hard for some people to get it. But now that all of them are going to be put online, individualized, you're going to have 370 million opportunities for hackers to get people's social security number and be able to create accounts elsewhere. And then it's going to take you a long time before you even realize that this is happening. So I want to hear from you about this digital social security card that the Social Security Administration is rolling out. Let me know your thoughts in the comments. I think this is a bad idea. I don't think they have shown that they can protect information to be able to do this, but that's my opinion. Let me know what you think in the comments. Now, let's talk about the president's first 100 days in office and all the big wins that he has advanced for seniors. So, the president, let me go to that section of my presentation. I think I lost my train here a little bit. So let's start with all the things that President Trump has done for seniors. So 2025 brings one of the most significant sets of updates to Social Security in recent memories. And every single change that is discussed today is going to affect how you interact with the Social Security agency. The first change that happened this year was the Social Security Fairness Act. If you haven't heard about it, $14 billion has already been paid out to 2.2 million people affected by the windfall elimination provision and the government pension offset. Automation now handles everything. So if you were impacted by this or you think you're eligible, you should have received notice from the Social Security Administration that you were eligible for $6,600 on average in back pay, and then up to $1,100 in Social Security increase. This started in March in terms of the back pay. They rolled it out through April, and then starting in April, those who are eligible are going to get their up to $1,100 Social Security monthly increase. This is impacting over 3 million people that were government employees that previously were denied access or were given reduced Social Security benefits because they were getting a government pension. So if you were impacted by this, this is great news. You should call the Social Security Administration and figure out where your money is. Another thing is that the Social Security Administration has identified $1 billion in cost savings during the Trump administration's first 100 days. Efforts include reducing travel, contracts, and printing. Efficiency gains mean that there's going to be more money that's going to be put in the Social Security system. And even though it's just $1 billion, it's just one agency. And so that is the improvement there. The biggest thing they have done is reduce the size of the Social Security Administration. Now, a lot of people may think that this is a bad idea. The Social Security Administration has reorganized its workforce, combining similar functions and breaking down silos. All teleworking employees have been asked to come back to work, improving service availability. And despite rumors, this is from the Social Security Administration, they have not permanently closed any field office. That is what they are saying. So if you have experienced anything different in your local area, I want to hear from you in the comment section below. And then they've also said that they have modernized their telephone system. All this information is coming from the White House press releases. They've modernized the telephone system at the Social Security Administration. Over 350 offices have already been upgraded with full rollout expected by the summer of this year. They're also using AI, new artificial intelligence features, which is being promoted by Elon Musk. About 30% of all Social Security calls are now being handled automatically by AI. So if you call the Social Security Administration, you're probably likely talking to AI 30% of the time. And this has improved how they are handling cases And they're saying that because of this use, they are able to answer your questions faster. So if you've experienced something different, let me know, because according to the press release coming from the White House, they have improved telephone efficiency at the Social Security Administration by modernizing their telephone system, and already 350 offices have already been upgraded, and AI has been introduced and is answering 30% of your calls. Another thing they've done to help seniors is fraud prevention and measures aimed at preventing scams. The Social Security Administration has implemented advanced fraud prevention telephone systems, analyzing accounts for suspicious activities. If irregularities are detected, in-person identity proofing is required. What does this mean for you? It means that they are safeguarding your information. If somebody calls the Social Security Administration and tries to use your information to gain access to your benefits, the system is supposed to detect fraudulent activity based on patterns that they've recognized, and then the person is going to be required to come in to the office to verify their identity. The SSA and its offices of Inspector General co-sponsored the 6th annual Slam the Scam Day to educate the public about Social Security imposter scams. And then enhanced security measures keep your personal information and payment safe from fraudsters. Another thing that has happened is this. You've probably heard the news that Elon Musk was saying that there were a lot of people who were over 100 years old collecting Social Security. Well, the president is saying that they've done something about that. The SSA has strengthened procedures to identify records of individuals who are likely deceased due to age or incomplete death reports. This reduces the risk of fraud using outdated records. Updating implausibly old records is a key anti-fraud measure, preventing criminals from using these identities. SSA has safeguards to avoid errors and can reinstate records if needed. To date, this is what they're saying: no living individual has been mistakenly removed from the Social Security record, and SSA has a process if they make a mistake to bring your records back. These efforts ensure Social Security payments go only to eligible individuals, preserving the Social Security benefits for those who truly are eligible and have worked and paid into the system. There's big news about overpayment, and this one has gone all over the place. The Social Security Administration originally was only collecting 10% of overpayments, and then they changed the policy to 100%. And then there was a lot of pushback, and we reported on this, and we urged a lot of you to call your Congress people and call your senators and your congressmen and women, and they heard you. And now they have changed the policy again to 50%. So starting March the 27th, if you receive a letter from the Social Security Administration saying you have an overpayment, they will only take 50% of your Social Security check and use it to pay the overpayment until it's paid off. This was an upgrade from the 100% where they were going to completely take your Social Security or disability check and use that money to pay off anything you owe in overpayment until it's all paid off. So I'm going to say that again. Overpayment has been shifted from 100% to 50% of your Social Security and disability check. And then there is payroll automation that's going to improve how Social Security Administration avoids overpayment in the first place. Typically, what happens is that people on Social Security who are claiming benefits before their full retirement age are supposed to be reporting their earnings if they are working. And if you're on disability and you're making more than the substantial gainful activity threshold, you're supposed to also report your earnings. That information never trickles down fast enough. So the Social Security Administration is always behind. And that is why you're getting hit with 50, 100,000, 150,000 in overpayment, because it takes them years later before they catch up to the fact that you are receiving more money than they should have given you. So this change that they're making is to link up directly with the payroll companies like ADP, etc., so that they can get payroll data directly from the payroll companies. so that the Social Security system will be much updated, much quicker, and much faster than waiting for individuals to update the Social Security Administration about how much money they are making, or waiting for the IRS at the end of the year to update the Social Security Administration about income, because that becomes lagging, and that's what gets people in trouble with overpayments, because by the time the Social Security Administration realizes that you're making more money and they should have deducted from your benefits, it's too late, and you've racked up all this overpayment that you then have to pay back, and by law they have to collect. Another thing they're doing is that disability beneficiaries are going to have an easier process when they're applying for disability benefits. Basically, this process is going to speed up how you apply. The SSA is expanding its partnership with healthcare companies to receive medical records directly from the healthcare companies. Electronic records will save the taxpayers $500 million annually by collecting medical records for more than 3 million disability applications each year. Faster access to medical information means disability claims are processed more quickly, and this is part of what the administration is saying they have done to improve Social Security, and in this case, disability benefits. And then there is the Social Security number verification. The Social Security Administration is improving electronic consent based on Social Security verification system, reducing operating costs by 40%. User fees are dropping by 25%, making the service more accessible. The upgraded system provides more detailed information, helping banks and agencies make better decisions. So this is another step in improving services that the Social Security Administration is doing. And then there is the scam alert. If you've been hit by scams or you are increasingly being bombarded by scammers, you need to listen to this. The Social Security Administration and its Inspector General continue to raise public awareness about Social Security scams. The annual Slam the Scam Day highlights steps you can take to protect yourself and your loved ones. SSA provides resources and tips to help you recognize and avoid scams. That's why it's important to visit the Social Security website regularly, especially their blog, because that's where they've been posting all this updated scam information so that you can take control and avoid becoming part of the increasing number of scams that are hitting seniors and causing them to lose a ton of money. So what's next? The Social Security Administration now publishes key performance data and updates on its website. So if you want to stay updated, check their website or subscribe to our channel, because we bring you the latest news and updates. And they continue to educate the public about scams and how to avoid them. The SSA is committed to keeping local offices open. This is directly coming from them, and make them accessible. In-person help remains available for those who need it. So guys, I want to be clear. This is all information coming from the White House and the Social Security Administration. So if you're experiencing anything different, let me know in the comments section below. Now let's talk about food stamps, because there is so much that is happening that you need to be aware of. So let's dig right into it. So I have said this before. President Trump has had this idea for a long time that he wants to turn food stamps, at least a big part of it, into what he called the harvest box. He has this idea during the first term and he couldn't push it through. And now the idea is back, is being rebranded as the Maha food box. What does this mean? Well, in his recent budget, which just got released on May 2nd, which is what, a few days ago. Today is May the 3rd. So that was yesterday. This was released. This is the press release. In the discretionary section of the budget, which is tucked into the press release, is that the budget supports the creation of a Maha food boxes that will be filled with commodities sourced from domestic farmers and given directly to American households. Now, what is all this? Well, this is RFK Jr. trying to change SNAP benefits. RFK is encouraging states to apply for waivers to ban soda, candy, and other junk food from SNAP, which is a good idea. He argues that SNAP benefits should not be subsidizing unhealthy eating habits and contribute to chronic diseases, which is a good idea. While SNAP is administered by the Department of Agriculture, RFK says he's collaborating with the Secretary of Agriculture to implement these changes. And then here's the one I want you to pay attention to. These proposed changes align with RFK's broader Make America Healthy Again agenda to address chronic diseases. So where does this harvest box come in? Well, earlier in Trump's first term, he wanted to turn part of food stamps into a box where the government picks shelf-stable items and then ships it to you each month. So you cannot go use your EBT card to buy food. The government will ship you food, at least for majority of your food stamp benefits. So this idea was around the first time, and then in February 3rd, it came back in the news. And a lot of news organizations did a story about it. And so here it is again. It looks like this MAHA idea is a repackaged idea of that. Essentially, what it means is that your food stamps benefit, or some of it, is going to be converted into a box of food that the government will pick and ship to you. And the way it's going to work is that they will pick shelf-stable foods. Obviously, it's being shipped. It cannot be perishable, and then ship it to you. It is part of a way to save $180 billion from the budget. And when President Trump proposed this previously, it was the biggest change he wanted to make to food stamps, costing $129 billion. And it was to cut SNAP benefits and shift a portion of it to food boxes. So the fact that this MAHA box is coming up, for me, I'm connecting the dots, and it makes me believe that the end game is to shift SNAP benefits into a box that the government will ship to you. Now, let's talk about SNAP changes that are happening. Congress is about to cut a huge chunk of SNAP budget that is going to impact 9 million people and knock them off the SNAP program. Congress is considering the largest reduction to SNAP benefits in U.S. history, with $230 billion in cuts over a decade. And guys, this is the news. It's all over the news now. You can Google it yourself, and you will see that Congress is, as we speak, negotiating this bill that will gut the SNAP program. I want to bring you all the details, so stay with me here. This is triple the size of any previous cuts they've ever done, and will dramatically shrink the nation's food safety net. Over 42 million Americans rely on SNAP to help buy groceries each month. If these cuts are passed, up to 9 million people will lose benefits entirely. Nearly 80% of SNAP households include a child, senior, or person with a disability. These groups are especially vulnerable to losing access to food assistance. And charities have warned that they cannot absorb the surge in demand. If millions lose food assistance, this could trigger a national hunger emergency, as food banks are already stretched too thin. So who will be the hardest hit? SNAP is a lifeline for many seniors and disabled individuals, helping them afford basic nutrition as food prices continue to climb. Without these benefits, many will be forced to choose between food and other essentials. Now, nearly 15 million children, about 40% of all SNAP recipients, depend on these benefits for healthy meals. Losing SNAP could mean more kids go hungry and struggle in school. And obviously, minority communities are twice as likely to be impacted by this. And many SNAP recipients are employed but will still struggle to afford food. So the idea that people on food stamps, or everybody on food stamps, is not working is not true. Actually, there's a huge majority of people who are working and collecting food stamps because they cannot make enough money to afford food, and so they need food assistance. If Congress approves these proposed cuts, as many as 9 million Americans will be dropped from food stamps. This would mark one of the largest single increases in food insecurity in U.S. history. SNAP currently supports over 22 million households, representing 1 in 10 Americans' families. Every one of these households face the possibility of reduced or eliminated benefits. States like California, Texas, Florida, and New York will see millions affected, but no state will be spared. Rural and urban communities alike would experience increased hunger and hardships. Now, larger households, especially those with kids, could lose about $250 per month in assistance. This dramatic loss could force parents to skip meals or cut back on nutrition for their children. Now, the proposed $230 billion cuts is triple any cuts they've ever done. This cut will reduce SNAP benefits by more than 20%, a level not seen since the welfare reform in the 1990s, where millions lost access to food stamps. When SNAP was previously cut, 10 million people were affected back then, and this looks like it's about the same or even worse. And there's no other program, guys. There is no other program at the scale of food stamps that can fill the gap. Food banks cannot fill this gap. Local charities cannot fill this gap. It is going to devastate a lot of families. And here's what the food banks are saying. In 2023, food banks served 50 million Americans, a 60% increase in some regions since 2020. Many food pantries are running out of supplies before the end of the month. And the USDA just recently, and this is fresh news, the USDA has cut a $1 billion in food bank funding, leaving charities scrambling to fill the gap. So not only are they cutting SNAP benefits, they're also cutting assistance to food banks. Feeding America and other experts warn that food banks provide only a fraction of what SNAP delivers. If millions lose benefits, food banks will be overwhelmed and unable to meet demand. With less federal support, food banks expect to offer less produce, meat, and dairy. Many already are canceling orders and rationing food, meaning recipients will get less and less and have to wait longer. And then there's the issue of rising food prices. Since 2019, food prices have risen 30%. Meanwhile, Social Security benefits have risen less, about 20%. So that 10% is why a lot of seniors are struggling to make up the difference that inflation has eaten in their purchasing power. And then pandemic era emergency food assistance also expired in 2023. So fixed income seniors can't keep up with these rising costs, forcing seniors and disabled people to make impossible choices. Many have to choose between food, medicine, and paying their utilities. And when households lose SNAP, it impacts health. Studies have shown that when they cut SNAP benefits, chronic illness, malnutrition, and developmental delays in children also increases. And then losing food stamps increases stress, anxiety, and depression for caregivers and seniors. And SNAP recipients face 27% more likely to skip medical care or medication in order to afford food. Now, this may all sound doom and gloom, but that is exactly what's happening. If they cut $230 billion from SNAP, it's going to have devastating effects that we've never seen before. And so if you don't like what you're hearing, this is the time to call your congressperson, your senator, and let them know that cutting SNAP is not okay. Remember, I said when you guys made a lot of noise about the overpayment issue, they listened and they backed off. They went from 100% to 50%. So do not think that your voice is not important. Do not feel that you are helpless in this situation. We can all do something to put pressure on Congress to not cut SNAP benefits, because it's going to devastate not only families and children and seniors and people on disability, but it also has local effects. SNAP dollars support local farmers and grocers, especially in rural areas. Cuts could reduce farm income by $30 billion. Many supermarkets and corner stores depend on SNAP shoppers to stay in business. With these customers, food deserts are going to expand, leaving communities with fewer healthy options. And then charities, as I said, cannot fill this gap. Food banks and pantries lack the resources to replace federal aid. They estimate that if SNAP gets cut, food banks can only absorb 10%. So the other 90%, it means that people are going to go without food. When hunger rises, states must spend more money on emergency services, healthcare, and shelters. This strains already tight state budgets, could lead to other vital programs being cut. So how does this affect seniors? Well, seniors on Social Security or limited retirement savings already struggle to cover basic needs. SNAP helps bridge that gap, and cuts will force many seniors to skip meals or go without essentials like heat or medication. And seniors are more likely to suffer from chronic illness that require good nutrition, such as diabetes and heart disease. Losing SNAP could worsen their health and increase hospitalization. And many seniors live alone and have limited transportation, making it harder to access food banks and community meals. SNAP cuts will leave them isolated, hungry, and at greater risk of depression and illness. This is real. As many seniors turn to already overwhelmed food banks and charities, these organizations may not be able to meet the increased demand. This could leave vulnerable seniors without any consistent source of food. And it could impact people with disabilities. Did you know that nearly 1 in 4 SNAP households include a person with a disability, many of whom cannot work and rely on SNAP for survival? Cuts will make it harder for disabled individuals to afford nutrition they need for health and independence. And here's another one. Over 1.2 million veterans rely on SNAP to help make ends meet, often due to service-related injuries or disabilities. Reduction could leave those who served our country struggling to put food on the table. And then poor nutrition could worsen medical conditions and increase hospital visits for people with disabilities and veterans. This will ultimately raise healthcare costs for everyone. And for many, SNAP is about more than just food. It's about dignity and ability to live independently. So the cuts threaten the stability and well-being of people who already face significant challenges, increasing the risk of homelessness and poor health. So what happens if the benefits are cut? Millions will go without it. And child hunger will rise. There'll be long lines at food banks, and poverty and instability would increase. So what's the bottom line here? This is going to cause a lot of pain, and food banks cannot fill the gap. It's going to put a lot of people at risk. If Congress passes these cuts, millions, including seniors, will face a devastating future. So let me know what you think about these cuts. I know that it looks like it's dark, but here's the thing. If we don't report the truth and let you know what Congress is doing, and as I said, you can Google this yourself and you can see that they're currently working on it in the House. They plan to cut $230 billion over 10 years. That is going to cut 9 million people at least from food stamps roll, and it's going to be devastating. Let me know what you think in the comments. And finally, let's talk about Medicare. I have some good news. If you're turning 65 or are currently on Medicare, here is what you need to know. A lot of seniors are frustrated with Medicare because there are 24,000 Medicare plans nationwide, and an estimated 90% of seniors are in the wrong plan. Finding the right Medicare plan for you can be very challenging, and that is why we've partnered with an amazing organization that is going to advocate for you. The Trump administration recently sued 3 Medicare advisory companies because they've been deceiving and misleading seniors. The company we are partnering with, Chapter Medicare, is trying to do the opposite. Their main goal is to help you understand Medicare, choose the best plan for you, and help you use your Medicare benefits and maximize your benefits. And why are we partnering with them? Well, it's because one of the co-founders went on this mission because of a personal issue. One of the co-founders of Chapter Medicare had watched his parents struggle to navigate the process of choosing a Medicare plan and wound up paying hundreds of dollars of premiums every single month that they should not have paid. He realized what a terrible experience this whole process was and decided to do something about it. And another of the co-founders of Chapter Medicare has this to say: when I first started my job as a Medicare advisor, I discovered that many Americans are getting misled into buying the wrong plans simply because no one took the time to sit them down and explain what's going on. Why am I telling you all this? Is because these guys are legit. Their mission is to make it easy for you to sign up, and they're here to save you money. When you call them, these are the people you're going to be speaking to. It is a free service, and their mission, these are real human beings from their website, and their mission is to do one thing: When you call Chapter, they're going to show you every Medicare option available to you in your local area, including detailed information about which doctors, specialists, prescription drugs, and hospital that are covered, and which co-pays are available. And then they're going to compare the plans that they're showing you to traditional Medicare so that you can make a decision for yourself. Guys, these guys are there to advocate for you and not advocate for insurance companies. And the biggest reason why we're partnering with them is because they don't pay their licensed agents to push specific plans. They are not there to advocate for the insurance company. They are there to advocate for you. So call Chapter 539-205-2147, or you can go to askchapter.org/insider, or you can go to the description to this video. I'm going to put a link there. You can fill out a form, and then they'll reach out to you and they will help you pick the best Medicare plan that fits your budget and fits your coverage that you need, the doctors that you need, and the prescription drugs that you need. And they can save you $1,100 on average a year. So guys, I want to make sure that you get this critical information. These guys are legit. They are highly rated by the Better Business Bureau, A+ rating, tons of 5-star reviews you can read for yourself online. So check out Chapter and avoid being one of the 90% of seniors that are in the wrong Medicare plan. Now, before I leave, here is the thing. We set up a newsletter that we can help you stay updated on everything that's happening in and out of Congress. There's so much going on right now in Congress. There's presidential, actions and the declarations, and Congress is passing laws, and things are changing with Social Security, Medicare, Medicaid, food stamps at a very fast pace. If you want to stay updated, go to our YouTube channel. There is a link in the description above. Click on it and enter your email address, and we'll keep you updated. And if there's any money saving tips that we have, you'll be the first to know. Stop missing out on your retirement benefits. Stay informed. Sign up for our newsletter. So that is all I have for you today on this Saturday evening. I hope that you found value in what I shared with you. If you did, hit the like button, hit the subscribe button. If you have any comments, let me know in the comment section. If there's a particular video you want me to create or a particular topic you think I should make a video on, let me know. I'll do the research and I'll make sure that I add it to my next video. So thank you for watching, and I will see you tomorrow when I do another live.